Welcome to Ageless and Outrageous, your favorite podcast about how to age amazingly. I'm urogynecologist and hormone and sexual health expert, Dr. Kristen Jackson. Every week, I share my over 25 years experience to guide both men and women as they age. Listen as I discuss a variety of topics, including hormone optimization, pelvic floor health, maintaining a vibrant sex life, weight gain issues, and skin, hair, and body changes as we age. It's happening to all of us, so listen for some solid scientific knowledge on how to handle these changes. Tune in for a dose of laughter, knowledge, and an honest perspective on the incredible adventure of growing older. Today, I want you to hear all about my favorite muscle group, which is the pelvic floor. The pelvic floor is a group of muscles that form the bottom of our pelvis. And if you've ever seen the bones of the pelvis, your hips and your pubic bone in the front and the base of your spine and your coccyx in the back, you know that the pelvis is open in the top and open in the bottom. So if we just had our bony pelvis, everything put in the top would fall right through to the bottom. That means in real life, all of our GI system, our bladder, our uterus if we're a woman, our prostate if we're a man, everything would fall out the bottom if we didn't have our pelvic floor in place. Pelvic floor muscles are striated muscles, meaning when we look at them under the microscope, they have these alternating light and dark stripes. And the pelvic floor is a general term. It actually comprises two sets of muscles. The front or anterior set of the muscles is called the levator ani, which in and of itself is a group of three muscles. The back or posterior part of the pelvic floor is the coccygeus muscle. And when we look at these two muscles together, the front levator ani with its three muscles called the pubococcygeus, the iliococcygeus, and the puborectalis, and the posterior part of the muscle, which is called the coccygeus, all of these muscles together make up the pelvic floor. Now, the pelvic floor is so important because it supports the organs, the bladder, the uterus, the vagina, and the rectum, and it is intimately involved with the function of all of those organs. So the pelvic floor is necessary to keep our bladder closed, except when we want to urinate, in which case the pelvic floor relaxes to allow the urine to pass. It keeps the vagina tight and closed, except when we're trying to have a baby or except when we want to be sexually active. When the pelvic floor muscles relax to allow the penis inside, it relaxes quite extensively. It relaxes quite extensively if we're giving birth because it has to allow for the baby's head to pass. The muscles are also important for fecal continence. One of the muscles specifically, the puborectalis, acts like a sling around the rectum, putting a little kink in the rectum most of the time. That's to make sure stool just doesn't fall out of us anytime it wants. During defecation, when we're moving our bowels, the puborectalis has to release. So instead of the rectum having a kink in it, the rectum now is more of a straight shot and it's easier to pass out our stool. So you can imagine if there is damage or dysfunction to the pelvic floor muscles, that we may have issues with bladder continence, we may have issues with vaginal function and sexual intercourse, and we may have issues with moving our bowels. Now, not every patient who has pelvic floor dysfunction has all three of these areas affected. Some just have issues in the bladder and vagina. Some just have them in the vagina and rectum. Everybody's a little bit different, but the pelvic floor as a whole is intimately involved in all of those structures. Now, if we look at the fibers inside the muscles of the pelvic floor, there are two different types of fibers. And these types of fibers are actually found all over our body, but we're going to talk about them specifically as they relate to the muscles in the pelvic floor. And those are slow twitch fibers and fast twitch fibers. Slow twitch fibers are considered fatigue resistant. The velocity with which they contract is a little bit slower. The force with which they contract is also a little bit less, but they can hold that contraction for a long time. Think about the muscles that keep us upright, Think about the muscles that keep us upright, that are responsible for our posture. We can't have those muscles conking out on us halfway through the day and then us all slumping to the ground. So slow twitch fibers are responsible for keeping muscle tension. Fast twitch fibers are a little bit bigger. They can contract with more force. They certainly can contract with more speed. And these are the fibers that we think of when we want to create a muscle contraction. So they can create a much stronger, quicker contraction, but they may not be able to maintain that strong, quick contraction for quite as long. When we talk about strengthening the pelvic floor, what we're really talking about is hypertrophying or growing in size these fast twitch fibers. The fast twitch fibers are also what we feel when we do a Kegel exercise. So when you're instructed to squeeze those muscles as if you're holding back urine or holding back gas, what you're really doing is contracting your fast twitch fibers within the pelvic floor. And then we feel a little lift or tightening of the pelvic floor. It's important to recognize that both slow twitch fibers and fast twitch fibers are found in all muscles. So all muscles have a grouping of both of these because they're both really important. They both do different jobs. And just like any muscle in the body, in the pelvic floor, we have this combination of slow and fast twitch fibers. So that's what's going on at the cellular level. But what's going on at a level that we can see and feel? Well, if as a grouping, the muscles of the pelvic floor are too weak, some of the symptoms we might see, I've already alluded to. We may have inability to store our urine, and that leads to urinary incontinence, whether that is stress incontinence, that's leaking urine when we cough, laugh, sneeze, exercise, or sometimes even bend down to pick up something heavy. Or we can have urge incontinence or overactive bladder. That is when we feel like we always need to go to the bathroom. We're rushing to the toilet. Sometimes we're leaking before we can get our pants down. We can't quite make it there in time. It's also associated with frequent nighttime urination. Both are associated with weak pelvic floor muscles. A second symptom you may see is an inability to store your stool, and that leads to fecal urgency or fecal or gas incontinence. So patients can describe a sudden need to move their bowels, and you kind of have to get everybody out of the way so they can hustle to the bathroom, an inability to control their gas is just leaking out, or, of course, the most distressing symptom, which is fecal incontinence, where they either see small balls of stool that are passing into their underwear or sometimes a little smearing of stool. As for the vaginal canal, patients with weak pelvic floor muscles may have a loose feeling during intercourse. They may feel a less intense orgasm because a lot of the pleasurable sensations that we feel during orgasm, we're actually feeling contractions of the pelvic floor muscle. So a weaker muscle leads to a less intense contraction. Some women will also describe that they lose the grip feeling of the vagina around the penis, or their partner may say, I don't feel like everything is tight anymore when during penetration and when I'm inside. I sometimes find it hard to tell, that the vagina is nicely fit around the penis. So all three of those issues are potentially associated with weak pelvic floor muscles. So what causes it? How would we get weak pelvic floor muscles in the first place? Well, probably the number one factor is pregnancy and childbirth. During pregnancy, the pelvic floor muscles are called upon to hold and support more and more weight as the uterus and the baby and the amniotic fluid all grow. So even just carrying a pregnancy to term puts extra stress and strain on the pelvic floor muscles. If you also undergo a vaginal delivery, those muscles can become overstretched or weakened during delivery. Sometimes they experience ischemia, that's lack of oxygen, especially if the baby's head is pressing for too hard and too long on the blood vessels that provide oxygen to certain muscles, and that lack of oxygen can cause the muscles to have dysfunction afterwards. A second cause can just be aging in general. As we age, all the muscles in the body, including the muscles in our pelvic floor, just don't just don't restore themselves the way they once did. It takes longer to build those muscles. It takes some resistance to build those muscles. So we lose muscle tone as we age. Plus, lifestyle factors can contribute. As we get older, we tend to have a more sedentary lifestyle, and general lack of physical activity leads to muscle weakness, and that includes the pelvic floor. But there are some other lifestyle factors that are specific for weakening the pelvic floor. The two that are the worst are chronic straining and chronic coughing. So, where we would see chronic straining is in patients with constipation. I'm not talking about bearing down to move your bowels. I'm talking about sitting on the toilet, taking a deep breath and holding it, and pushing with all your might over and over again because the stool is not moving. Having that chronic pressing and really hard pressure against the pelvic floors can weaken them. Or if you were to have a job in which there is chronic, repetitive, heavy lifting, you can also weaken the muscles of the pelvic floor. I'm thinking of one of my patients whose job was to unload the trucks as they came to Walmart. And she had the back and shoulder brace on to protect her back and posture. But just her lifetime of unloading those Walmart trucks put a lot of stress and strain on her pelvic floor. Chronic coughing is the other one. So, smokers who have a chronic smoker's cough, patients with allergies who are constantly coughing because of that constant coughing can put excess stress on the pelvic floor. Now, when we talk about aging related to loss of muscle, I always say, of course, aging does slow down cell turnover everywhere in our body, but for men and women, it's really the loss of testosterone and hormones as we age that more rapidly makes us lose our muscle tone. So, as women go through menopause, we lose our estrogen. With age, we lose our testosterone, and both of those hormones are so important for maintaining blood flow to the pelvic floor for estrogen and muscle tone for testosterone. So, as we lose those hormones during menopause, we can see a more rapid muscle loss, and that includes the pelvic floor. Being overweight or obese puts additional strain on the pelvic floor. Since the pelvic floor is the bottom of our torso, it's got to support everything above it because we're upright 90% of the day. So if your weight is heavy, that pelvic floor just has more to carry and more to strain against. Think about those slow twitch fibers having to maintain strength all the time against a heavier weight versus a lower weight. It's obviously easier for the slow twitch fibers to maintain tension against a lower weight. Any type of surgery in this area, specifically hysterectomy or pelvic floor surgery, can, in theory, potentially weaken or damage the muscles. If the blood flow to the muscles is interrupted, if the nerves to the muscles are injured or damaged, they're not going to be as healthy after the surgery as they are prior to the surgery. And speaking of nerves, certain neurological conditions that may damage nerves can also injure the pelvic floor. These are things like spinal cord injuries or MS, multiple sclerosis, because of the damage to the nerves in those conditions. If it so happens that the nerves to the pelvic floor are damaged, typically here we're talking about sacral nerves, sacral 2, 3, and 4 nerves. If those nerves are involved, then we may see bladder dysfunction, bowel dysfunction, and pelvic floor dysfunction. So that's a long list of what potentially can damage the pelvic floor. And when patients come into me with possible weak pelvic floor, not only am I doing a good exam of their pelvic floor, but I'm taking a history to see if they have any of those risk factors. And as I said, childbirth and delivery is really the number one. But a lot of patients don't see the damage that childbirth causes to the pelvic floor when they have their babies. And that's mainly because younger women tend to have babies, so they still are young and have decent muscle tone. They still have good hormone. They still have a good hormone environment because they've not yet gone through. They still have a good hormone environment because they've not yet gone through menopause, and they don't have any chronic diseases like chronic constipation or chronic coughing, so they're not repetitively straining their pelvic floor. Where they see the damage come out is as they enter menopause. Then they start to notice, I'm feeling a pressure, I'm feeling more urinary incontinence, I'm feeling more difficulty holding in my gas, sex is changing for me. So the damage occurred at the time of delivery, but the symptoms from that damage don't occur until many years later. Hang on. Once we've identified that pelvic floor damage or weakness has occurred, what can we do about it? Well, certainly we always start with things that are under your control. We talk to patients about lifestyle modifications. What are the things that are damaging your pelvic floor that you can remove? Managing your weight or reducing your weight, controlling your chronic cough, treating your chronic constipation so you're no longer straining, modifying your lifestyle to make sure that you don't have inappropriate, heavy, repetitive lifting. All of these lifestyle modifications definitely make a difference. But I will tell you, lifestyle modifications work best when they're done before you have any significant pelvic floor damage. Once you have significant pelvic floor damage, you may not notice as much of a result just making lifestyle modifications. Going along with that, there's proper body mechanics. You want to make sure that when you are lifting, whether it's in your normal life or whether it's at the gym and you're lifting your weights, we want to make sure that we're using good mechanics. You should always lift a heavy weight close to your body. So you never want to lift a heavy weight with your arms extended where the weight is far from your body. That's bad for your back, that's bad for your pelvic floor. So bending your knees, getting all the way down to the floor, holding the weight that you need to hold close to your body, and then standing up is really important. And doing that, training yourself so that you have proper habits of good body mechanics is important. So you do it every single time. Beyond that, we're going to talk about how can we rehabilitate the pelvic floor muscles. Well, one of the first exercises that almost any physician is going to tell you to do is Kegel exercises. These are a common and easy to do exercise. You simply squeeze your muscles as if you were holding back gas or stool and then release. How often and how long you should hold the how often you should do Kegels and how long you hold the Kegel exercises, you'll get different recommendations from different people. But a good rule of thumb is to do 10 Kegel exercises, so 10 squeezes and release. Try to hold each squeeze for 2 to 3 seconds before you release, and a set of 10 3 times a day. Ideally, it's also best to do Kegel exercises in different positions. So one set of 10 while you're sitting, one set of 10 while you're standing, and one set of 10 while you're lying down, since we do use our pelvic floor muscles slightly differently in those 3 positions. While I do recommend that patients do Kegel exercises, I think the most important outcome of a Kegel exercise is that it keeps the nerves in your brain properly connected to the nerves in your pelvic floor. So it helps you to activate your pelvic floor, activate those fast twitch fibers when you want to. But remember that when we are doing a Kegel exercise, we are really just taking our muscle, our pelvic floor muscle, through its normal range of motion, tightening and then allowing it to release back to its baseline tension. We are not straining the pelvic floor muscle beyond its normal workload. And if you've listened to my other podcasts, specifically the podcast on muscle, you will know that in order to build muscle or hypertrophy muscle cells, we've got to strain the muscle beyond its normal range of motion. Normally, the way we do that with skeletal muscles in our arms, legs, back, glutes, is resistance training. Put a weight on that muscle, put a band on that muscle, something like that. It's really challenging to put a weight on the pelvic floor or certainly put a resistance band on the pelvic floor. Where would that even go? Some people have tried to do this by using vaginal weights, or sometimes they're called vaginal eggs. But they are a device shaped like an egg, but and it is weighted, that you slip into the vagina and you Kegel around the vaginal weight, trying to maintain it inside the vagina. And vaginal weights come in different weights, just like free weights do. But I don't know of any definitive data showing that either Kegel exercises alone or weighted Kegel exercises with the vaginal weights actually make any muscle hypertrophy. What they might do is give you a little bit of symptom relief. So if you have a weak pelvic floor and you're having some urinary incontinence or some gas incontinence and it's not too severe, doing Kegel exercises with or without weights may help to improve those symptoms. But when we actually measure the muscle on MRI before and after Kegels, we don't see hypertrophy of the muscle with those activity. In order to get muscle hypertrophy, we've got to put some stimulation to the muscle. So as I said, normally if it was a skeletal muscle, we would do resistance training. We can see definitive muscle hypertrophy with resistance training. But in the case of the pelvic floor, the best way to apply energy to that muscle to make it hypertrophy is with electromagnetic energy. And in our office, we do this with a device called the Emsella chair. The Emsella chair is so easy to do. You sit on it fully clothed so that you're basically applying the muscles of your pelvic floor to the seat of the Emsella chair. Then the chair will direct a cone of electromagnetic energy through the muscles of the pelvic floor. That electromagnetic energy is going to cause the muscles of the pelvic floor to contract in tetany. Tetany is when the muscles are contracted and held in their tightest contraction that they can do. And on MRI studies, we can see that a series of treatments with the Emsella chair does actually cause a lift and thickening of the pelvic floor muscles. So we know that it is not only improving symptoms of urinary incontinence, fecal incontinence, and sexual wellness, it's also showing a physical lift and thickening of the muscle on MRI studies. Now, if we really want to improve the health of the pelvic floor, we combine that pelvic floor hypertrophy with the Emsella chair with some form of testosterone therapy, especially in menopausal women, because we know that menopausal women are losing their testosterone. Testosterone is a critical hormone to help build muscle anywhere on the body, and the pelvic floor is no exception. So having appropriate levels of testosterone around first, and then applying energy to the muscle to grow it, that's how we're going to get the most bang for our buck with building the pelvic floor. Now, we've spent a lot of time talking about pelvic floor muscles that are too weak and all of the symptoms that can come from that. But the opposite problem can occur as well, and that's that the pelvic floor muscles can become too tight, and they're almost in spasm all the time or most of the time. When pelvic floor muscles become too tight, patients lose the ability to properly relax them when they need to. And remember, we talked about those muscles needing to relax to allow urine to pass, to allow gas and stool to pass, and to allow a comfortable sexual experience. So if that muscle is in a constant state of tension and is unable to get to that relaxed state, you can imagine that patients may have bladder symptoms, feeling like they can't empty their bladder all the way, feeling like they always need to go to the bathroom, but they're never quite getting it all out. They can have vaginal symptoms, pain with intercourse, pain. Sometimes it's just pelvic pain all the times outside of intercourse as well, because that muscle is in spasm. And they can have rectal problems, constipation, difficulty emptying their bowels, or feeling like, again, they have a bowel movement, but they don't get that full relief, like they're completely emptied. So unlike weak pelvic floor muscles, hypertonic or stressed pelvic floor muscles are caused by a whole different set of issues. One issue I always look for in anyone with tight pelvic floor muscles is a history of trauma, whether that is a past history of physical or sexual trauma. Our muscles' job when they are traumatized is to tighten up to protect us against future trauma. So that muscle is doing exactly what it was designed to do because there is trauma in the past. The problem is if that trauma is not ongoing, the muscle doesn't know that, so it forgets to relax. It loses its ability to relax. It still thinks it's protecting the body against that trauma. Sometimes the muscle can become tense due to other muscle imbalances. So, no muscle in our body works in isolation. The pelvic floor muscles, while they do form the bottom of our pelvis, are attached to our also work in concert with our hip muscles, our abdominal muscles, and our back muscles. So, if any of those muscles are out of whack, if our posture's not good, if our gait is incorrect, if we have back pain that kind of hitches us up, we're going to have imbalance in our pelvic floor muscles, and they're going to have some tension related to those other muscles being out of whack. And this is not something that just happens overnight, but we see it happening with patients over time. So, someone who has really poor posture, who's hunched, who's not using good body mechanics over time, your pelvic floor muscles are going to try to make up for that by tensioning and tightening and getting your spine back into the proper position, but they're not working because of the hunch that the patient has. So over time, many months and many years, we can then see tension in the pelvic floor. Sometimes the tension in the pelvic floor ends up happening as a secondary response to something else. So, any chronic pain conditions in the genital region, like vulvodynia, that's pain around the vaginal opening with no other source, painful bladder syndrome or interstitial cystitis, or endometriosis, because these conditions tend to be chronic and they cause pain over a long time, what do your pelvic floor muscles do? They tighten up to protect you against that pain. So, if we don't intervene treating these chronic pain conditions early enough, not only do you have the chronic pain condition, the endometriosis or the interstitial cystitis, now you have a second source of your pain, which is the tight pelvic floor muscles that have occurred because of the first condition. Just like nerve issues can cause a weak pelvic floor if there is damage to the nerves and the nerves can't fire appropriately, nervous system dysregulation or dysfunction can also contribute to muscle overactivity. This is one of the most confusing things that happens in multiple sclerosis. MS patients sometimes have this relapsing and improving condition where first muscles are tight and then muscles are weak and then the muscles are okay, and it can change over time. So, if the nerves to the pelvis are underactive, that means the muscles they serve, the pelvic floor muscles, are going to not be contracting as much as they should and deemed weak. Whereas if the nerves to the pelvis are hyperactive, they're going to be firing too much, and the nerves and the subsequent muscles in the pelvic floor are going to be tight. And finally, we see a high association with the tense pelvic floor with chronic stress and anxiety. So, emotional tension sometimes is manifested in our body as muscle tension. And we don't just see this in the pelvic floor. Sometimes chronic stress and anxiety comes out in the body as chronic migraines. Sometimes it comes out as chronic GI issues. Sometimes it comes out as chronic bladder issues. But in this case, for some women, that stress and anxiety can localize into that chronic pelvic floor tension. So, when evaluating a patient with high tone pelvic floor causing pain, of course, I'm going to want to go through this list of causes and see what causes I can remove in the first place. So, it seems strange to think that you might put someone on an anti anxiety medicine to treat their pelvic floor condition, but sometimes that's what needs to be done if the chronic stress and anxiety is a cause of pelvic floor tension. So, stress management is really important for patients who have high stress in association with a high tone pelvic floor. Just like we talked about for a weak pelvic floor, lifestyle modifications can also be done for a high tone pelvic floor. Most importantly, we want to think about things like good posture, proper walking, so we have a proper gait, proper lifting techniques. All of those things are very, very important. And this brings me to my next treatment, which is just like for the weak pelvic floor, we use our pelvic floor therapists for a high tone pelvic floor. This is really an important cornerstone of treatment because a trained physical therapist will help to identify where the spasm is in the pelvic floor. They may do some manual therapy, which is using their fingers inside the vagina to do some myofascial release. They may find some trigger points, which is like a knot of a muscle that they can release. And all of that helps those muscles to begin to function properly. They can also recommend therapeutic exercises to stretch and release the muscle. They very often work with breathing and relaxation techniques to bring more blood flow to the muscle. And most of the pelvic floor therapists are going to look at the pelvic floor in relation to the rest of the body. So they're also going to see, are your hips in proper alignment? Is your posture good? Is your spine in good alignment? Because as I said, if we don't have all of that lined up together, the pelvic floor is always going to remain tight, trying to correct the problem. Sometimes, if there are trigger points identified in the pelvic floor, they might recommend specific vaginal dilator therapy. So, this is using a little wand or a dilator that goes into the vagina and is aimed at that trigger point to release the muscle tension in it. I've also done injections into certain areas to release tension in those trigger point areas. If there isn't just one area of tension in the pelvic floor, vaginal Botox injection has shown really good results at releasing the pelvic floor tension as a whole. For some women, vaginal Botox injection is something that can easily be done in my office. As long as I can comfortably get my fingers in the vagina, we can do a couple of quick injections of Botox into the vagina. We can do a couple of quick injections of Botox into the pelvic floor muscles where the tension is. Botox works the same in any muscle we put it in, which is an overly tense muscle, and help break that spasm so it no longer causes pain. In addition to Botox, there are some other medications that might be recommended. I'll tell you that in my experience, muscle relaxers have not worked very well for the pelvic floor, but certain vaginal inserts, like an insert of vaginal Valium, can work very well. An insert of vaginal gabapentin, which is a neuromodulator, can work very well. And the benefit of using these vaginal inserts is that unlike taking a Valium by mouth, which is going to make you feel sleepy and tired and woozy, Placing the vaginal Valium doesn't seem to have those side effects. So the muscles of the pelvic floor will absorb that medication without the systemic side effects. All of those medications that I just mentioned have to be compounded through a compounding pharmacy. There is not a standard product that you can recommend, but the compounding pharmacies I work with are very familiar with this type of formulation. So once again, I am always in awe of the amazing job that the functional pelvic floor does for us. It holds tension in itself, but not too much and not too little. It's the Goldilocks muscle. It's keeping everything supported and closed. It's relaxing when it needs to. It's tightening up when it needs to. But unfortunately, damage to the pelvic floor, whether that leaves it too weak or too tight, causes a problem on either end of the spectrum. So if you think you might be experiencing symptoms of either a pelvic floor that's too weak or a pelvic floor that's too tight, just know that there are specialists who can examine and help with these symptoms, and there are a lot of treatments that are available to you. Thanks so much for listening to today's episode. No information from this recording is intended as a diagnosis or treatment for any disease. If you are enjoying the show, please subscribe so you don't miss any of our exciting episodes. And we love to hear from our listeners and would be grateful for your positive review. We'll talk next time.